it's an important conversation because I think there's probably the most amount of potential misinformation on the internet regarding this subject. There are plenty of people who will say, "Oh, you have to do an M block if you want to have any chance of feeling better, or if your surgeon doesn't do an M block, you're not giving yourself the best chance of improving your symptoms, etc." This is the biggest study to date done on breast implant illness. They followed 3 plastic surgeons in different hospitals around the country and looked at whether or not an explant made someone's symptoms get better, and then whether or not it mattered whether or not they did an M block or total calcectomy. And the data in that study matches mine to the number. That is to say that the woman who has these weird symptoms, but otherwise, work is pretty much normal, 80 to 90% of women do notice an improvement in symptoms when they get their implants out. But it does not matter whether or not you do a total calcectomy or an M block. The rate of improvement is exactly the same. An M block means that you remove the implant and the capsule as one solid piece. Like basically you don't even see the implant,
right?
Because it's all contained within the bubble scar tissue. And a total calcectomy means that you dissect around the capsule as much as you can, but at some point while the implant's still in your body, you make a cut in the anterior capsule, you reach in, you remove the implant, then you wash out the inside of the capsule, you clamp the capsule shut, then you finish the dissection around the back side of the capsule and remove the capsule. So either way,
it's all still coming out.
100% of that capsule is coming out.
Okay.
You don't have to do an M block to remove 100% of the capsule. The difference is it coming out in one piece with the implant, or is it coming out in 2 pieces? But either way, it's all coming out.
Okay.
And again, the data shows that it does not seem to matter whether or not you do an M block or a total capsulectomy. Your rate of improvement is 89% either way. What probably matters is that you actually get rid of the capsule. But if I'm correct, and this is just a foreign object problem, then that makes sense why it probably doesn't matter whether or not you take the implant out or the capsule out in 1 piece or 2 pieces. What matters is that all of the foreign material is gone by the end of the operation. And again, that's what the data seem to confirm.